Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Types of tympanoplasty, we are looking at the Zollinger and the wullstein classification. So there are 6 types which we need to know. So beginning with one. So one is nothing but the myringoplasty. So myringoplasty finding is all ossicles are intact. So if we look at the ossicles, all are intact. Next, what is the procedure? The graft placed over. So the procedure, the graft placed over will be the over and under remnant TM. So the procedure and graft placed over or under the remnant TM. So it will be over and under the remnant TM. TM stands for the tympanic membrane and over the handle of the malleus. So this will be over the handle. So it is over the handle and this is of the malleus. Next we move on to the type 2. So here it is the remnant TM over the handle of the malleus. Next is the type 2. So in type 2 the finding is that the malleus is eroded. So in type 1 everything was intact, ossicles are intact. Here the malleus is eroded. It is eroded. So the procedure and the graft placed over, it is over the remnant malleus and incus. So it is over the remnant malleus as well as the incus. Next we move on to the type 3. So here in type 3 or the columella. So it is the type 3 or the columella or the myringostepidiopexy. So it is a myringostepidiopexy. So to repeat, type 3 columella and the myringostepidiopexy. So here the malleus and incus are absent. So type 1 everything was intact, then the malleus goes away, then is eroded, then the malleus and incus is absent. So type 3 means the malleus as well as the incus, they are absent. So the procedure and the graft is placed over the stapes suprastructure. So it is over the stapes suprastructure. Now let's move ahead. So now we look at the type 4. So how is type 4? So type 4 is also known as the cavum minor. So it is nothing but the cavum minor. So here all ossicles are eroded. So it happens in stages. First is malleus, then malleus incus, and type 3. Then type 4, it is all ossicles are eroded. So all ossicles, they remain eroded. So the graft is placed over the ET. So it is placed over the ET, eustachian tube, as well as the round oval window. So the round window, and it leaves the mobile footplate exposed. So the mobile footplate, it remains exposed. So next we look at the type 5. The type 5 or stage 5. So here it is nothing but the fenestration surgery. So type 5 is nothing but the fenestration surgery. So here the finding is that there is a fixed footplate. So there is a fixture of the footplate. So there is a fixed footplate and the graft is placed over an opening made in the lateral semicircular canal. So it is the opening. So an opening is made in the lateral semicircular. So SS semicircular canal. Opening at the lateral semicircular canal, and this is nothing but an alternate pathway. It is nothing but an alternate pathway. So here the type 5 fenestration surgery, the footplate remains, the fixed footplate is present. Next, lastly, we'll look at the type 6 or the sono inversion. So type 6 is nothing but the sono inversion. The sono inversion, the graft here is placed over there is a round window, this is left exposed. So this will be exposed and it receives the sound and the oval window is covered. So this receives the sound. So this will receive the sound and the oval window is covered. So when you look at the oval window, this is covered. That is, there is a reversed pathway. So some other important note is that in type 3, the type 3 is known as columella. So why is it called as columella? Because it is the middle ear. So it is very similar to the middle ear of that of the birds, since they have a single ossicle. And another note is usually there are about 1 to 5 classification, and the 6th one is being a recent addition. To learn and grow daily like this, please do subscribe.